What finding on an anterior-posterior chest radiograph is most specific for acute thoracic aortic injury? Indistinct aortic arch contour. Chest radiograph. Pacemaker insertion. The leads have been placed via the left subclavian approach and passed down the left mediastinal border before forming a loop with the tip projected over the right ventricle. Most likely explanation? A persistent left superior vena cava. Echocardiogram. Dilated right atrium and abnormal tricuspid valve with a small, dysplastic but functioning right ventricle. Diagnosis: Ebstein's anomaly. Chest radiograph. Cardiomegaly with a prominent atrial appendage, a double heart border, a fine ring of calcification behind the cardiac shadow and prominent upper lobe blood vessels. Diagnosis: mitral valve stenosis. Carbon dioxide was considered as a contrast agent. When should carbon dioxide not be used? Intravenously in Eisenmenger's syndrome. 64-year-old male smoker. A duplex ultrasound showed a stenosis within the left popliteal artery. What is the most likely cause? Atherosclerosis. Previous inferior myocardial infarction. Which vessel is most likely to be responsible for the infarct? Right coronary artery. Cardiac magnetic resonance. Dilated right ventricle with a reduced ejection fraction but a normal left ventricle. High signal within the right ventricular free wall on T1 weighted imaging, suggesting fatty replacement. Low percent lidocaine can safely be administered. 10 ml. Man. Received a liver-related renal transplant, became oliguric on the third post. Operative day. An ultrasound. Likely diagnosis? Arrhythmogenic right ventricular dysplasia. What characteristic would make a diagnosis of a true ventricular aneurysm more likely than a false aneurysm? An aneurysm that protruded only in systole. Which of the following native grafts is most appropriate for bypassing the left anterior descending artery? Left internal mammary artery. What additional feature would make chronic thromboembolism a more likely diagnosis than systemic to pulmonary circulation shunting? Mosaic attenuation. Cardiac MRI. Apical hypokinesis and dilatation with normal basal function. Most likely diagnosis? Tacote subocardiomyopathy. Contrast enhanced CT of his thorax. Flap was seen to originate just distal to the origin of the left subclavian artery and to extend into the left common iliac artery. Appropriate Stanford classification? Stanford type B. Lady. Sudden onset right hemiparesis after lifting a heavy shopping bag. CT of her brain. Two foci of low attenuation within the posterior frontal lobe and anterior frontal lobe. Also noted to have an erythematous, swollen left calf, which was confirmed with a Doppler study to be due to thrombus within the superficial femoral vein. Next most appropriate radiological investigation? Echocardiography. Echocardiography for an acyanotic shunt. Dilated left atrium and ventricle, dilated right ventricle, undilated right atrium and undilated aorta. Most likely cause: ventricular septal defect, VSD. What ultrasound feature is most in keeping with a diagnosis of deep vein thrombosis? Loss of phasic flow on Valsalva. 23-year-old intravenous drug abuser. Ultrasound of his left groin. Superficial abscess with non-occlusive thrombus in the left common femoral vein. Echocardiogram. Echogenic intracardiac mass. What is the best explanation for these findings? Tricuspid valve endocarditis and septic pulmonary emboli. Harsh ejection systolic murmur in the left parasternal region. His chest radiograph. Calcification in the region of the aortic valve. Most likely etiology: a congenital bicuspid aortic valve.
acute thoracic aortic injury इसमें क्या होता है? इंडिस्टिंक्ट aortic arch होती है। अगर दूसरा अगर बाइट मेडिसिन भी हो ऑप्शन दूसरे एमसीक्यू में तो वो भी आंसर हो सकते हैं। ठीक है, जो भी ऑप्शन में आए। रेजिस्टेंस ऑफ स्क्रू में क्या हुआ, ये भी आसान है। ठीक है, लीड्स पास डाउन द मिड लेफ्ट मेडिसिन बोनर। लेफ्ट लॉ में ड्रिवन फ्रॉम हाइपोप्लास्टिक लेफ्ट हार्ट सिंड्रोम होती है। और इसमें यह होता है कि स्मॉल dilated right atrium and small right ventricle। और इसमें दूसरा ऑप्शन लेफ्ट वेंट्रिकल एनेरिज्म में गलत है। बस ये फाइंड रिंग ऑफ कैल्शियम सीन बिहाइंड द कार्डियक शैडो होती है, लोकेशन है मिटरल वॉल की। स्नोजिंग द लेफ्ट पॉपुलर आर्टरी डायग्नोसिस एथियोस्क्लेरोसिस। ठीक है, तो स्मोकर हो और उसको क्लैरिकेन हो और फिर पॉपुलर दूसरा ऑप्शन है पॉपुलर इंट्रैपमेंट। इसमें होता है कि वो कहेगा आपको एमसीक्यू में कितने द वेयर पॉपुलर ऑडियो तो फिर इस एमसीक्यू में ये दूसरा ऑप्शन गलत है। population entrapment. ठीक है, इसमें पेपर के एनरोल फिर इसके अलावा मॉडरेट हो जाती है फिगर्स एलटी का डायरेक्शन होती है।
Contrast enhanced CT scan. Main. Pulmonary artery has a diameter greater than ascending aorta and the central pulmonary arteries are calcified. The peripheral pulmonary arteries have a pruned appearance. What is the likely pulmonary artery pressure? 25 mmHg. ECG. Q waves in leads 2, 3, and F. When would you expect peak differential enhancement of the myocardium in the right coronary artery territory following administration of iodinated contrast? 10 to 15 minutes. Chest radiograph. Large heart with a small-looking aorta and echocardiography showed paradoxical movement of the interventricular septum. Most likely cardiac abnormality. Ostium secundum atrial septal defect. Pain and paresthesia. In his left hand. Doppler ultrasound demonstrated a stenosis of the left subclavian artery. In which artery would flow reversal be most likely? Left vertebral artery. Well-demarcated rounded mass in the paracardiac region. The attenuation was 3/8 Hu. Hypodense to myocardium. Where is this mass most likely to be situated? Right cardiophrenic angle. A blush of contrast is seen near the end of the stent graft. Which type of endoleak? A type I. With regard to imaging with PET-CT and the use of F18 labeled FDG, which of the following is the most accurate statement relating to the behavior of the radioisotope and acquisition of counts? The dominant annihilation photon interaction in tissue is Compton scatter. Cardiac stress myoview study. What would indicate that terminating the study is the appropriate thing to do? Increase in diastolic blood pressure above 120 mmHg. She is otherwise well except for bilateral osteoarthritis in the knees. What is the best form of imaging to assess for cardiac ischemia? To myoview rest and chemical stress. Which is the most appropriate line of investigation to further investigate a pulmonary embolus? Reduced dose ventilation / perfusion scan. Ages are listed as 28, 30, 32, 55, 66, 67, 70, 70, 72, 83, and 87. What is their median age? 6. Chest radiograph. Multiple cysts in all zones of both lungs. CT scan showed numerous diffusely scattered thin-walled cysts surrounded by normal lung parenchyma. Diagnosis. Lymphangiomyomatosis. CT. Lymphadenopathy on both sides of the diaphragm and a sample taken at mediastinoscopy showed Reed-Sternberg cells. Arbor stage of this disease. Stage 3. PA chest. Radiograph. Widened mediastinum and a CT confirmed a lobulated anterior mediastinal mass. What is the likely density of this lesion? Similar to skeletal muscle. Peripheral eosinophilia. Chest radiograph. Cystic structure that contained an air fluid level with a thin radiolucent crescent in the upper part of the lesion. Cassini skin test was positive. The most likely diagnosis? Hydatid. Had worked in the construction industry. Chest radiograph. Multiple calcified pleural plaques were visible bilaterally with basal interstitial shadowing. There was also an ill-defined mass in the left lung. Most likely etiology of the pulmonary tumor? Bronchoalveolar cell carcinoma. Man with severe rheumatoid arthritis. Chest radiograph. Where in the lungs are the reticulonodular densities most likely to be located? Bases. CT. Solitary 2 cm endobronchial polypoidal mass that enhanced vividly in the late arterial phase.
ये पल में हाइपरटेंशन होती है तो पूर्ण अपीयरेंस पेपर में हाइपरटेंशन 24 तक नॉर्मल है 25 हाइपरटेंशन पल्मोनरी आर्टरी हाइपरटेंशन तो ये है P1 MI है। जी इसमें फिर जब माइक्रोकार्ड याद करो कि जो क्यू है कॉर्निक माइक्रोकार्ड पास में इसमें जो है फाइब्रोइड होती है तो बहुत टाइम लगेगा एनहेंसमेंट में, तो कम से कम 10 मिनट्स लगेगा, 10 to 15 मिनट्स आंसर है, ठीक है। क्योंकि क्यू है इसमें ना फाइब्रोइड हुई ये ऑस्टियम सेकेंडम जब लगेगा प्राइमम नहीं है, ठीक है। प्राइमम जो है कोई भी आंसर नहीं है, बस वो बनता है एंडोकार्डियल क्वेश्चन से। ट्रस्ट एट एंड ऑफ स्टैंड तो ये टाइप 1 एंडोलीग है। counts is now dominant element proton interaction in physics compensated. Here, what indicates is the appropriate thing to do increase in diastolic blood pressure for 130 mm mercury, ठीक है। ठीक है, ये हाइपरनाइजन की तरफ जा रहे हैं। For cardiac ischemia, to minor rest and chemical stress, use the bilateral osteoarthritis. Reduce dose well perfume के फुल सिनेरियो में कुछ है मैं कहाँ से प्रेगनेंट फीमेल है तो इसलिए हम रिड्यूस डोज करते हैं। ये आंसर इसमें बीच में जो आंसर है 67 ये आंसर है, ठीक है। इसमें ये लिस्टेड तो मीडियम ये भी फीमेल है नॉन स्मोकर तो इसमें लिम्फेडेमाटोज होती है। साइड ये टाइमोमा है, ये मोस्ट कॉमन एंटीमेस्टियल मास है। skin test positive, highlighted. Asbestosis is related with mesothelioma and bronchoalveolar carcinoma. तो ये फाइनल से bronchoalveolar carcinoma की जो आंसर है। नॉर्मल डिजीज है तो ये लंग के बेस में होती है, ठीक है। तो दूसरा एमसीक्यू में आता है आंसर एलिमेंट फ्यूजन और ये जनरल